Thank you very much, Dr. Bahani and Dr. Zahrani. It's a distinct pleasure again to welcome all of you to this CAR-T and gene therapy symposium. I'm just going to give you an overview of what's happening in the Middle East for a few minutes, and then we're going to start with our sessions. As you know, this is a huge region with 58 million people, and the therapies for the indications for gene therapy have increased tremendously. It includes cancers, monogenic diseases, which are rampant here, cardiovascular diseases, neuro diseases, ocular diseases, and many other diseases that we're studying this. So it's about time that we take the gene therapy from the European and American spectrum to all over the world. And we're trying our level best to do that. Here comes the CAR-T therapy. It's just tip of the iceberg, because I'm not going to go over the cell therapies in detail, like mesenchymal stem cells and TEALs and NKTs and other therapies, but suffice to say that the tissue-specific therapies and MSC therapies have increased tremendously as well, and these are the actual trials that are happening in different categories. And as we speak, the MSC trials actually have already filed for approval in the United States as well for mesenchymal stem cells for graft-versus-host disease. So they have increased as well, and now we want to bring them and translate these trials into clinical practice within Saudi Arabia. CAR-T cells, we're going to hear a lot about in the afternoon sessions today. And we have many trials in B-cell malignancies and solid tumors as well. And here on this slide, you can see the TCR receptor and the TEAL therapies as well. So we have a lot of spectrum, a lot of indications for these therapies. And that's why this 578 million people, at least this is a starting point. But obviously, we don't consider ourselves a distinct entity, a distinct region. We actually want to focus on all the world, in fact, in developing countries, and be a model actually for the countries which do not afford that. How can you do the trials? Actually prove to them we can do trials, studies, and actually do this on clinical basis eventually. And there's consanguinity is high. I mean, 34% currently from 58% is decreased in Saudi Arabia, one of the highest in the world still. And there's a heterogeneous ancestry like many other countries and regions. So that thereby it's imperative that we start the gene therapy and the CAR-T trials, and we've already started the hemophilia B gene therapy trial. Dr. Zahrani and myself are the PIs on this, and we already finished the first phase for lead-in now study going on hopefully in summers, and multiple trials are already on the way, SFDA approved for the CAR-T cells as well. So we're going to hear a lot about gene therapy and CAR-T cells today. I welcome all of you, and we're going to have discussions as well. But the benefits of this conference today are humongous. So we're going to start a new thought process, a technical expertise development to actually benefit the people of this region, but the developing countries in general of the world. So thereby, we're going to start with talks on the basic science, like some understanding of the basics, the regulatory approvals, and then we're going to go to specific diseases. With that, I would welcome all of you, Ahlan, to this conference, Cell and Gene Therapy Symposium. And I'm also going to welcome the two chairs of the session, which is the first introductory session for the Gene Therapy and CAR-T Symposium today. That's going to be Dr. Hassan Al-Salh and Dr. Hawazin Al-Saidi. I believe both of them are here. Professor Salh doesn't need. Professor Salh, you can come up and chair the session and introduce the speakers. One of the world leaders in transplantation, EMBMT founding member, and many other hats that I can't even describe. Thank you very much.